First of all, a warm welcome to all the panelists. Thank you so much for taking our time. And I'll begin with giving a short introduction of each of the panelists so that our viewers know who they are listening to. The first one is Mr. Anand, who's the CEO of SRL Diagnostics, which is basically a diagnostics chain. And Mr. Anand personally has about 25 years of experience in the healthcare industry, specializing in diagnostics and laboratory services, not only in India, but in South Asia, Africa, and Middle East. His knowledge of the industry and his business acumen makes him understand complex issues and enables him to connect the dots. And that is the value that he brings to this discussion today. Thank you so much for being here, Mr. Anand. We also have Dr. Shravan Subramanyam, who is the president and CEO of GE Healthcare for India and South Asia. And apart from that, he's also the managing director for Wipro GE Healthcare. He has held global and regional leadership roles at Novartis, Dade Behring, I hope I'm pronouncing it right, Earlis Laboratories. He's an active voice in the industry. We've seen him in various panel discussions. He's not only an MBBS doctor, but he's also got his master's in health administration. Welcome, Dr. Subramanyam.
Thank you, Harbinder.
Joining us today also we have Mr. Govind Rao, who is the CEO of NMC Genetics, which is a genomics company with a focus on preventive healthcare, pharmacogenomics, and R&D. Now, NMC provides preventive solutions in India as works with 16 countries worldwide. They not only work with the government, they also work with private hospitals, clinicians, and research facilities. Welcome, Mr. Govind Rao. The last panel's last question would be my first question to you. That how do you rate Union Budget 2022 with focus to healthcare? So let me ask Mr. Anand first. On a scale of 1 to 10, how do you rate the Union Budget when it comes specifically to healthcare?
So I would rate it somewhere around 6 or 7. So I think it's mainly because it's been very underwhelming for healthcare. So we've talked about very few issues has been discussed, and many things which we thought in the post-pandemic situation, which will bring a lot of focus on healthcare, especially on infrastructure, on preventive health, were not to be seen in detail. Maybe it will come as part of some annexures. We'll find something more interesting, but as of now, it doesn't look like it's very interesting for us.
Got it.
Harbinder, I would echo what Anand said. I'd probably give it a 7 because I think healthcare is what has been holding the economy hostage for the last couple of years, and one would have expected a lot more bold steps in healthcare. But perhaps to Anand's point, we might be seeing annexures coming up. Having said that, the few points that they did cover in healthcare are bold and far-reaching. So I would give, I'd say it's a qualified 7 with potential, I think, to go a little better.
I will say it is 8 and or 9. So unlike the biggies of Gs and SRLs, it is really a good move from the government, from the digital side of it. And it will immensely help startups, telehealth, digital health, and the novel tech, which is like a light-on asset. And but it has a very major role to play in the transformation of the healthcare. But yes, there is other side of it. But I'm representing startups and the tech, so I believe this is really good. This is long way to go, and this is a good start.
Awesome. So since you're talking of digital and you're talking of tech, my first point that I want to bring up is that government has announced the National Digital Health Ecosystem. And that has been the key highlight of the budget today when it comes to healthcare. And where they're talking of creating an open platform, which will also serve as a digital registry, talking about health facilities, talking about healthcare providers being registered, the unique health identity, universal access. These are some of the key terms that they've used. What do you have to say about this? What are the things that you see as a benefit for the healthcare industry and the efficiencies that this particular platform could offer in India? So let's begin with Dr. Subramanyam.
Harbinder ji, I think this is a transformational moment for Indian healthcare. And depending on who you're having a conversation with, some people refer to this as the UPI moment for healthcare. You know, like how Unified Payments Interface came into being just maybe 6 or so years ago. This could similarly democratize healthcare. I mean, when was the last time we used cash for a transaction? This is my wallet. And if the same thing could be done for healthcare, this could make healthcare accessible to a much larger body of people. It would make health insurance schemes far more meaningful. But for this to happen, we need collaboration at every level. You know, the other esteemed panelists here, we will all have to work together to make it happen, because no one industry or company can make this happen. The basic digital infrastructure is still very much lacking in India, right? In order for this ambitious project to work out, we need basic things like a lab information system, electronic medical records, picture archival systems for radiology. All of these have to be there. And then they have to be interoperable. Then they have to be portable. And all this has to be done with patient privacy at its core. So the objective is laudable. But to actually make this happen, this needs a lot of effort from the government, a lot of investment from the government as well as from the private sector. And it has to reach every segment of healthcare, right? It's not just enough if it's there in the tertiary centers or some of the sophisticated hospitals. Your primary health center, your community health center also has to have access to these digital tools to truly make this work. Harbinder ji, I've seen this in operation in countries all over. Some countries get it right. Typically, if it's a small country like a Singapore or Taiwan, Estonia, these places are able to get it right, and it's just absolutely transformational. If you want to make additional investments in digital technologies such as using artificial intelligence or decision support software, etc., for clinicians, you need to have this foundation. But other countries, large countries, advanced economies have struggled with this because it requires the whole ecosystem to come together. So if you were to ask me for the score again, I would say this is a 9 on 10 as far as digital health is concerned, because it puts us in the right direction. It gives us a framework, it gives us the guidelines. And I've interacted with government officials on this topic. They are very open and anxious to make an impact here. So very excited about this, and thank you for this question.
Mr. Anand, I'm taking the cue from what Dr. Shravan just said, and I want to pick up that key term called universal platform, because, India has seen a lot of development when it comes to health tech and digital healthcare, but unfortunately, it is always done in silos. So you have every large hospital having their own healthcare information system. You have their health records being maintained, but interoperability has never seen the light of the day. And now with this particular initiative, do you think we are in the right direction, and what needs to be done both at the government end and at the private sector end, in your opinion, to make this a success?
Harbinder, that's a very, very important question that you're asking now, and I fully agree with what Dr. Shravan just now said. So it's a very important moment, UPI moment for healthcare, as he said. So this digital Ayushman Bharat digital mission and what they're trying to do now in terms of creating a digital registry of healthcare is a very important development. And, in fact, I'm proud to say that SRL is the first laboratory to actually become, part of an integrated service with ABDM. So what this brings about is this kind of interoperability and portability between the healthcare services that we have. So currently, even if you take the case of diagnostics, each hospital, each lab has different codes for different tests. So you can't take one report from one lab and go to another lab and use it to take it forward. They will say you have to do these tests again. So because there is no continuity in the process. So this this adoption of LOING codes, international codes, and when we go for an insurance-based system, which currently we are 90% out of pocket in terms of healthcare expenditure, but once we move to an insurance-based system, all this kind of digital integration will help us in moving towards a much more seamless kind of interoperable structure between the various healthcare facilities. And I think this is a wonderful development, and government has been pursuing it in the last 3 years. And this year it's going to be a huge push, since they are saying that ABDM is going to be officially launched and rolled out to everybody in the form of digital IDs, in the form of registering healthcare providers at various levels, and that is definitely an important development.
Dr. Rao, we've seen that genomics, genetic studies actually help a lot in preventive healthcare. And unfortunately, we've seen that these kind of studies, these kind of things are very, very expensive. Do you think this step towards technology and digital healthcare, how does this help the genomics industry and making it more accessible to people in India?
So Harbinder ji, I mean, when it comes to genomics, you're rightly mentioned, it's expensive. And there are primary reasons why it is expensive. The capital equipment which is required, they are imported. Then the reagents and the consumables which are used, maximum, I mean, 80 to 90% they are imported. And of course, there is import duty. And of course, when you import, there is a price which comes from the outside India. So that is one aspect of it. And second aspect is it's a kind of a chicken and egg scenario. I mean, if the price is high, the uptake will be low. If we really reduce it, and then maybe we can look at the uptake on the samples. But coming to the awareness, I think awareness have multifold post-COVID. People understand the importance of genomic studies, what the DNA-based test can bring in. But with this digital ecosystem, so what this digital ecosystem is bringing is the reach, the awareness. But of course, all these things will not happen unless there is a very solid infrastructure at the place. As Shravan mentioned, if at the end point, if we don't have the good connectivity or a good instrument and good EDC, which is electronic data capture of the patient data, then these things will not really provide those output or the value which as an objective of the whole national digital health system is looking for. And if that happens and the execution happens, I think genomics per se, all these tests will reduce. And we have seen this last 2 years, the cost of per COVID test was X, and it has come down like 20 times or maybe 30 times lower now. And government has intervened at the right time. They have taken the right steps. They made sure the availability, they made sure the prices. And something similar is required in these kind of scenarios for the genomics to actually reach out to the masses. And genomics certainly has a very large role to play in the preventive healthcare. And with this ecosystem, it certainly can make changes.
Got it. Thank you, Mr. Rao. Now, the next question or next point that I want to discuss with all of you is not a part of any of our specialty, but it impacts everyone around us. And it is a very warm, welcome sign that mental health issues have been recognized by our government for the first time. Where the finance minister has announced the launch of National Tele-Mental Health Program that includes 23 tele-mental health centers of excellence with a nodal point and which has already been recognized. Mr. Anand, how do you see this pan out? I mean, it's a very beautiful thought. And we've seen a lot of things happening in the private sector, but this is a pretty large program that they are talking of. How do you see this pan out? I want everyone's view on this, starting with Mr. Anand.
Thank you, Harbinder ji. So actually, mental health, as we know, over the years, the awareness about mental health has increased. And people are coming to terms with the fact that the mental health is something which needs to be looked after and needs to be, it is something which somebody has to connect regularly to understand. So I think this pandemic, COVID pandemic, the work from home situations, the loss of jobs, and the sort of fragility in the ecosystem that created, it has brought to fore the importance of mental health, and the government recognizing this and coming up with this kind of a tele mental health plans program is something very important and very encouraging for all of us. As you know, mental health is one of the things that can be very easily amenable to the telehealth platforms, and using mental health as one of the first key drivers in this program is also a very important development. And I'm sure that this will help not only health workers like us, in our organizations who have been affected by the pandemic and who have been stressed out. We had created mental health hotlines within our company for our own people, and as part of initiatives by organizations like Nat Health, we had conducted regular programs where we could encourage healthcare workers to come and talk about their issues and give solutions for them. So I think this is a very important initiative, and I fully I'm happy about it and encourage it.
Dr. Subramanyam, what are your thoughts on this?
Harbinder, again, I would echo what Anand said, that this is something that has very much been needed. Just to frame this in context, think about it. Less than a decade ago, certain mental illnesses were considered to be criminal, right? Suicide or attempted suicide was decriminalized only recently. So you can imagine how far we have gone from calling it a criminal activity, then decriminalizing it, to where we are today. So I think we're definitely taking steps in the right direction. And this is something that affects all of us, whether we're in business, whether in the community. This is something that we have to take cognizance of. This was actually a part of the national health policy that came out in 2017. So at that point itself, we were quite hopeful that at least, the government is paying attention to it. And hopefully with this kind of awareness and with the decriminalization, the social stigma associated with mental health will also eventually go away. As Anand pointed out, several corporate companies have been investing in this. And we saw a spike in utilization during COVID because there was so much stress with families who were either, affected by their jobs or school, or people who are unwell, people who are dying, and the need for mental health definitely spiked. And the uptake was also quite substantial. This was done in a very confidential and safe manner. And whatever I'm hearing is this is helping our people. So definitely a step in the right direction. Now, how is this going to translate into something meaningful or tangible for our population? That is something that we have to see. We have to find a way to ensure that every district has access to this. Harbinder, we don't have enough experts to support this. Right. So, there's a broader conversation we need to have about, certainly good that we are talking about it, that there is a policy, that there is going to be investment. But then when we come to execution, who are going to be the experts? How do you create the infrastructure? Is it all going to be virtual, or will there also be a combination of physical? So these are some open questions that we have in this topic, but certainly a step in the right direction, and we must support this.
Mr. Rao, what do you think about this? And what is your take on this?
I think that this was a surprise, to be honest. While the whole world is talking about mental health during the pandemic, but considering the country like India, where infectious diseases like TB or the COVID for the moment, and cardiovascular diseases, diabetes, which is like on the number 1, 2, 3, or 4, government. It has shown that government is like not just aware, but they were very strategic in a way to take mental health into the mainstream. Because it's the right time to tackle it. The rate at which the digital things are moving up, the rate at which the awareness is moving up, the rate at which the smartphones adoption is, I think implementing mental health care is relatively easier with the novel tech solutions, tech platforms, because all others are intensive in terms of the specialties, assets, hospitals, and all. But if you look at the mental health, it's more about it's primarily more of a counseling and talking the right things, reaching out to the right person at the right time. Now, maybe it is starting with the 20 centers given the digitization and the whole ecosystem, think of a lady having an issues in somewhere 300 kilometers away from the city. And if she has to reach, now I don't know the numbers of the psychiatrists and the mental health experts, but they are on the very, very lower side. I believe maybe they are in the range of 6,000 or maybe 8,000 or maybe 12,000 at the highest. But consider a lady in the rural side needs a help, and all she can access a healthcare professional over the telehealth. Nothing better than that. I mean, that's amazing. I mean, that's if someone at the team or a council who has really thought of building this and taking a digital ecosystem as a base is tremendous. And we have seen recently during the pandemic and in the recent startups who are actually working on the real tech, where a friend of mine who has started, and he's using voice as a marker to diagnose what is the rate at which a person can actually getting affected with the stress or mental health and all. Think of those standard questionnaires, which has been vetted and validated for so many decades. These things can reach to the end user sitting in the rural side and think the kind of a real care where they can get it over the phone or a thing. I mean, this is tremendous. I mean, and this is a large opportunity, not just for the startups, but I think for the large organizations, this is a real good opportunity.
I completely resonate with you, and I think it's a big step not only for the technology advancement and digital and making it accessible, but I think making it announcement as a part of the budget, just making it mainstream, just creates an awareness of it being recognized as an issue by the masses itself. Now, we've spoken about the two great things that we have seen positively coming out of the budget, but let's come on to something that was actually expected of the budget. Every thought leader was talking of it, but we have not seen an explicit mention of it. Every thought leader was talking of the government increasing the expenditure, healthcare expenditure on infrastructure. And specifically, when we've seen something drastically happen or going wrong during the second wave, where the healthcare infrastructure almost collapsed or crumbled under the pressure. Now, I can understand that this is a one-off situation. It happens in pandemic. It has also happened not only in India, but even in advanced countries, Western world. But it has exposed our preparedness to handle such kind of challenges. Mr. Anand, what is it that you have to say about not announcing increase in expenditure, which was expected to be announced to be at a level of 2.5% to 3%? What is it that you have to say about this?
So I think we are still not sure about what is the kind of healthcare expenditure that's going to be expected, because I think it will be in the annexures to find out what exactly it is. But the way it moved from 1.3%, 1.5% over the last so many years up to 1920, and coming to 2021, we have seen that it has gone to 2.1% of the GDP. And we had targeted actually to reach 2.5%. But we are in the right direction, and I'm sure that something will be done this year, considering what has happened during the pandemic. In terms of improving healthcare infrastructure. So the investments that are required, both in terms of creating primary healthcare facilities, creating preventive healthcare options, and these things require, and also for especially the tier 2 and tier 3 towns, how are we going to take this forward? So these require investments as well as public-private partnerships initiatives. So I think that spend has to be increased, and I'm sure there will be something in the positive direction that we'll find in this budget.
Dr. Subramanyam, what is your take on this?
So this has been probably one of the longest standing discussions and asks from the healthcare and health medtech industry over the last several years. And if you look at some of the other countries, Harbinder, you look at some of the advanced economies, they're spending anywhere from 10 to 20% of their GDP on healthcare. The US in the high end of that spectrum. Probably, of course, the last couple of years, it has been skewed by COVID, but even leaving aside COVID, we're talking about spending above 10% of your GDP on healthcare to have a meaningful impact. And by this, I mean, there are so many ways to spend on this. It could be on education, it could be on infrastructure, it could be on insurance. And you can argue the merits of, overspending and pricing. So none of the systems worldwide are perfect, but by and large, there can be an argument made that an increase in healthcare spending has some sort of a directly proportionate impact on better clinical outcomes. And yeah, there are some details and nuances, but broadly, we all, I think, agree that we need to consider an increase in healthcare. Now, how that is spent is what we need to question, and over what period of time and where it goes. Anand rightly made the point that we need money to be spent on healthcare infrastructure. We saw how we struggled with the pandemic in the last couple of years, that hospitals were overflowing during the time that we needed it the most. But it's not just for COVID, Harbinder. Even with other diseases and disabilities, we need to maximize capacity available to them, make it easily accessible and affordable. See, India is largely an out-of-pocket payment market, right? Despite everything that we have done. And over the last 20 years, we've seen exponential growth in insurance, whether it's from the government side or through the private sector or individual insurance. It has improved tremendously. But I would argue that while we look for an increase in the number of insured, the number of insured are still underinsured, meaning the cap that they spend on insurance is very low. Even as a corporate company, sometimes it's not sufficient to cover some of the procedures that might affect some of us. So we need to increase the base, and we need to increase the depth of insurance. So across all of these, I think there is an opportunity here. When you consider, especially the needy, we do have, of course, the government has introduced a very grand insurance program, which is very welcome. And we're starting to see, while there were some arguments for and against it over the years, we're starting to see pretty good traction there, especially in tier 2, tier 3 geographies. We're seeing increased uptake of it. But how do we scale that up to make sure that no one is left behind? That is a question that we have to ask in terms of this. Because when you consider those folks, Harbinder, the direct benefits transfer for healthcare, right, whether it's through insurance or through cash transfer, is going to make an impact both in terms of health outcomes for the individual and the family, as well as their economic viability as an individual and a family. So this is where my hope is that there are going to be further discussions on healthcare expenditure, and we will see more details. Last year, we saw a largesse that was earmarked towards healthcare. I was hoping that this year we would see more specific, targeted healthcare expenditures coming our way. I'm still an optimist, Harbinder. I'm hoping that we'll see some more details coming out in the coming weeks.
You know what, Dr. Subramanyam, you brought out a very beautiful point about insurance. And you brought it very beautifully that, while we are making a headway towards increasing the penetration and having more and more people insured, but we are underinsured, And one of the aspects that I was very looking forward to specifically to healthcare was in terms of reduction on the GST. Whether it is for insurance, whether it is towards preventive healthcare tests, pathology lab tests, or towards anything. I mean, look at, the life-saving drugs. I have not seen any suggestion from the government on that front, because that is what is creating a disincentivizing situation when people actually purchase a health insurance. That 18% और लग जाएगा, इतना expenses बढ़ जाएगा, it's an annual commitment. So what do you have to say about that? I mean, that was something which was expected.
Yeah, if I may just continue on that thread, Harbinder, and I'm sure my other colleagues would also have a view here. Look, we have to look at both the input credits as well as output, right? So as a hospital or a service provider such as SRL Diagnostics, they are paying GST on their inputs, whether it's reagents or whether it's consumables or capital equipment, services, whatnot. And there's a wide range, it could be 5% in some cases, 12%, 18% in certain cases. So on a couple of accounts, Harbinder, I think we need to revisit this and have a very open dialogue on this topic, right? Number one, we need to think about rationalizing the GST for these inputs. Because it's really confusing when you have so many of these, and then at some point you introduce composite GST also, where you take the highest of the three slabs if you're getting a product which has a composite of multiple products. That is very confusing. That makes it expensive. And here we are talking about improving and increasing access to healthcare. And if you're increasing the input cost, how do you improve access to healthcare? So in terms, and now the hospitals are handicapped because what do they do with this? They don't have an output. They can't take credit for this because they can't charge GST for their patients. So I'm not an expert on the service side, but I could make an argument that you introduce GST on the service side for the hospital and service providers. It could be a very low GST or even a zero rating so that they can at least take the credits for the inputs that they are paying. This will rationalize GST for healthcare, medtech, services, products, consumables, all of these. And we can still make an argument that this will be improving access to healthcare for the common person. So this is my take, but I'm sure healthcare service providers might have a sharper take on the output.
So, Mr. Anand, what is your feeler on this, and what is your feedback on this specific thing?
Yes, Harbinder ji, this is a very, very important aspect which we have been talking about for so many years now since the GST regime came about. So it is simply because those embedded taxes that come to us, we are not since healthcare is not on GST, so we don't tax tax it to the patients. So what happens is the entire cost is absorbed by the system, and this is an additional cost which all other sectors are able to go through this as a GST transition platform, and they're able to imbibe that cost. And if we are able to this embedded credit which is trapped in this healthcare value chain, if it can be unlocked and it can be rationalized, so that will be a great advantage for us. Because as you know, today, if you take my industry, the laboratory diagnostics, so almost 80% of our the stuff that we use are imported. So we are also, for when we talk about Atmanirbhar Bharat, and we have seen what happened during the pandemic, when we had logistics issues, so international connectivity, there was a time when we had issues with, supply of kits. Even for COVID, there was a shortage of kits. For some of the COVID-related tests, there was a shortage of kits. And that was putting healthcare in a very bad situation. And if we had, more manufacturing and more things happening within India, sourcing happening within India, and if we had a better structure on GST as well, so we would be in a better position to provide better pricing to our patients as well. So because today some of the costs are also increased because of the GST regime. So that is something like, what Dr. Shravan said, we can look at how do we actually, take care of this, whether, there could be some sort of a GST on healthcare services so that there is a chance for us to offset this against what we pay to our vendors.
Reasons of cost or whatever, India has, when it comes to health checks, it has always been a reactive market. कोई बीमार हो गया, उसके बाद health check कराना है, सब कुछ कराना है. But preventive healthcare has always been neglected in India, and it requires some attention. Is there something that government can do to incentivize people and push them towards preventive healthcare so that it not only just makes healthy, it reduces a burden that we have on our healthcare system? So I want to understand, what do you think that the government can do to push this as a cultural change through its programs? Mr. Anand.
So I think you nailed it right, Harbinder ji, because preventive healthcare is very critical. So when we don't have prevention and promotion of good health, so that is going to be very important. If you're going to talk about everywhere, we are talking about moving away from illness and moving into wellness management. So if that is going to be the priority of the government, it's important for us to understand using the whole process of digital India as well, the digital health tech, to understand population dynamics, to understand population health data. So the government could actually release a lot of data based on this, the digital universe that they are creating in the healthcare ecosystem, which will actually help us identify those important aspects which needs to be looked at when we talk about both disease management, disease prevention, as well as health promotion. So with that, there could be a policy framework where, depending on since India is geographically wide, so depending on regional requirements, we can look at specific preventive programs which can be driven by the government. As of now, there is only one push towards preventive health, which is like, you could do a 5,000 rupees of health checkup at the end of the year, which could probably save you some tax. So beyond that, I think there should be more incentives, how it could be tied up to insurance programs. Somebody who's into a lot of wellness, whether they're taking some fitness programs or they're doing certain tests, and if they show some improvement in their test parameters, they could get a discount on their insurance premiums, something like what we have, a no claim bonus kind of a thing. So those things could be incentives in terms of promoting preventive healthcare. That's my take on this.
Mr. Rao, do you think such kind of incentives, I mean, if we, for example, increasing the tax saving amount of 5,000 rupees to say 25,000 rupees, do you think it's going to give impetus, growth, acceleration to something like genetic testing?
Certainly, certainly it will help. There is no question about it. Right now there is nothing. So anything which comes to help, it will certainly add to the preventive test. But I totally agree with what Anand mentioned. I think the first and foremost is the awareness and the education, why it is important. People change their phones every year or maybe once in every 18 months. So why can't the health preventive lifestyle, which is a life-saving, or we can detect something early and can be managed much smarterly, should be certainly a main agenda of the government. So education and awareness is the one thing, and certainly if insurance can play a very vital role in this, because that gives a lot support at the consumer level. And I think these two things as a start can really trigger things fast.
Got it. Dr. Subramanyam, government has taken a focus, it's got a very focused approach towards made in India scenario, and it is motivating Indian manufacturing, that it takes off, gets acceleration. Specifically in medical equipment space, how do you see things change, or how do you see things taking shape in the coming few years? Do you think we are well poised to take this on, both in terms of our capabilities, our pricing, and the quality that we desire in healthcare specifically?
So, very good question, Harbinder. I'd say, the last couple of years have shown us what we are capable of. I recently came across a publication from the Andhra MedTech Zone, Dr. Jitendra Sharma, who is talking about, not just made in India, but made during pandemic. So clearly we have the capability, we have the creativity, we have the infrastructure that enables us to do it. But this can't happen overnight. If you look at the pharma industry or the automotive industry, India has become a powerhouse in these areas over the last few decades. We are trying to accelerate this into a few years when it comes to medtech. And, medtech is now starting to have a voice in some of these conversations. I'm so grateful that you invited me here. This just goes to show that, medtech now has an important role to play in healthcare and in the economy at large. Over the last couple of years, we've seen the government introduce schemes such as production-linked incentive. And Wipro GE Healthcare has invested 100 crores now towards that to localize many of the products that were previously being imported. And this has an impact across the value chain, right? So it's not just our products which we are bringing in. Our extended ecosystem suppliers are also getting localized, because when we are manufacturing here, it makes sense to localize even the sourcing. So we are seeing that downstream impact across the board when it comes to localization. We still have a long way to go. Currently, we have 3 factories. We've put down a 4th one. And we're also playing to our strengths, and not just as Wipro G, but across the Indian medtech sector. We are playing to our IT strengths. So it's not just the hardware that we are producing here. We're also developing the software solutions that are supporting the medtech space. To the point that you are alluding to, do we have the capability? I think this is an area where we need to continue to invest in education, in research. Right now, we are developing products in India for India, but we should also develop products in India for the world. That is already happening. It's not that it isn't happening, but it needs to happen at scale and across product areas, across disease areas. And the whole healthcare ecosystem needs to come together. Teaching hospitals, corporate hospitals, government hospitals. We all need to come together to make this more viable, more exciting than it already is today.
Mr. Anand, I would like to get your views on this as well, because you are in an industry where you need to continuously update yourself, and your dependency on equipment, lab equipment, and also the reagents, etc. That's a huge cost of your business. So do you think that made in India kind of a scenario is going to come in really soon, or is it something that is a thing that we can expect in the next couple of years later?
So I think, as Dr. Shravan pointed out, I think many companies are making this move towards Make in India. Even multinationals are setting up factories for manufacturing stuff here. But it's a slow process. It's not something which can be achieved in a couple of years. It's going to take time. But at the same time, the push from the government is also required. The pandemic did trigger this. We found many kits for COVID itself being manufactured in India. So we found RT-PCR tests being manufactured in India. We found rapid antigen tests, home-based testing kits being manufactured in India and being sold. So, and this emergency use authorization approvals and all, we have seen how these things work. So otherwise, the whole process of getting a thing into the market is a very tedious process. So the government has to go through this in a different way, because how these imported things are classified, the Medical Devices Act, all this needs to be relooked at, because as you know, R&D is very important. If you want to continuously evolve, and with the new diseases and new disease management protocols coming up, like what Govind was saying, if we talk about genomics as well. So it's all about an evolving field. It's about continuous evolution, and R&D is very critical. And it's very interesting that even when in this meeting, in this budget discussion, we found our Honorable FM talk about genomics in one word when she talked about the sunrise sectors. She did talk about genomics. So I think the spend on R&D is very critical, because we can't only just depend on the kits which are manufactured and sold by companies, but labs have to have their own R&D, and they have to develop what is called as lab developed tests, which will actually be very specific for the Indian population. So today we are importing kits from the US, UK and all that, and we are not developing kits for the Indian population. When we do that, that's a lab developed test. So the regulations need to change to accommodate these kind of R&D methods, and how do we put it to clinical use. So that's also an expectation which has to happen to actually fast track this kind of Make in India and Made in India models to work.
Mr. Anand, I want to bring your attention to something that Dr. Shravan had mentioned about education sector and training sector. Now, one of the big challenges we face in India is the availability of medical professionals. And this has been something which has been a talking point for many years, but not much has happened in this direction, which is concrete, which has really helped us bridge the gap. And the debate about quality and standards, which is imperative for producing good quality doctors. What are the kind of what are the kind of reforms that we need in medical education that can help us bridge the gap between the demand and supply for quality doctors, quality health professionals?
Harbinder, this is a very, very important aspect which we need to cover because our doctor to patient ratio is also very high compared to other countries, and it's not just about medical doctors, the entire allied health professionals as well, whether it is nurses, pharmacists, medical technologists, the paramedical workers in the hospital. So we have a shortage of all these streams, as well as and medicine is an evolving field. It's a growing field, and we need to have continuous reskilling and upskilling of all this manpower, which is also something which a program which the government also need to come up with in terms of how do we actually keep our medical professionals updated and qualified to take on the requirements. And we are seeing that more and more focus is on tertiary and quaternary care. And when we talk about primary care, we have a lacking, and we only find very few government infrastructure involved in that, and less motivation on private sector to get into that. So some sort of incentivization and sort of priority lending kind of models that would help private sector to enter into this community-based primary healthcare systems as well. And providing training and in the rural population as well, in tier 2 and tier 3 cities, to bring out more allied health professionals from these to train and develop and credentialize people from these systems as well, so that we have some sort of a parity in terms of the quality of manpower that we have in the healthcare system across different geographies and metros. So that is something which we need to really look at, because today we are seeing the disparity in quality is quite visible in many locations. So how do we actually bring about that parity, so that that kind of upskilling and reskilling requirements and encouraging more people to come into this field is very important for the government to do something on.
Dr. Shravan, since you come from a medtech space and equipment side, and you also pointed out that we saw during the pandemic a lot of innovation, development towards production side took off, and we saw a lot of startups coming in it. But my fear is that we also saw a lot of frugal development that happened, which was very disorganized. It was just a jugaad kind of a thing to where they saw an opportunity, whether it was to make money or whether it was to actually genuinely help the society. But there was a lot of jugaad which was there. So while we saw a lot of innovation, there is a need to organize this, and there is also a need to give that boost to the startups. What do you think the government can do to give that boost that the startup ecosystem requires, so that they're incentivized to invest their time, energy, and money in the healthcare sector?
So very good point, Harbinder. I think the pandemic showed us what our startups are capable of. And we saw some very good technologies, right? And as Wipro GE, we worked with some companies that very quickly developed AI tools to help diagnose COVID, or diagnose or score a COVID patient based on their X-ray or CT scan. And this happened very quickly. We were able to integrate it, and we were able to make it widely available to radiologists and clinicians all over. We saw some advancements in point of care testing and management of imaging. We saw some advancements in also tele-ICUs, right? Because we had a capacity constraint. How could we use one hub with multiple spokes using technology to spread this out? Your point is very well taken, that this has to be, it can't be jugaad. Patient safety is at the core of any innovation. So when we're evaluating a product that comes to the market, we always look at safety first and then efficacy. So we need to ensure that we're not putting any patients or healthcare workers at risk. Then we look at the efficacy, and then based on on what kind of impact it makes, we think about bringing the right product, and then we talk about, okay, how do we finance it, etc. To that end, the private sector has invested considerably. We have multinational companies as well as the private equity and startup community that's looking at this very favorably. I've been talking to a lot of startups that have energy in this space, whether it's direct to consumer or within the hospital to solve some sort of a patient problem or a workflow problem. But I have to say, we have a pretty robust drug controller who's reviewing medical devices, medical products, and they're also now looking at a framework for digital solutions to make sure that patient safety is not compromised. So I think that is a first step. It's already underway. In terms of investment, there are various funds. The government is also incentivizing startups. As I said, private sector is also doing it. And the global, this is right for global investment also. So we shouldn't rely just on our government, but think about the global healthcare ecosystem. A long way to go, but I think we're making some strides in the right direction.
I totally agree with you, Dr. Shravan. I mean, we've seen digital healthcare take off in the last couple of years, and more so in the last 2 years. I mean, we've seen, mobile penetration, internet access, user-friendly apps, which have changed pharma to pharma tech, insurance to insurance tech. And we've seen telehealth and telemedicine become a reality. So I hope this impetus continues. We continue to see this acceleration. I think we've run out of time. And I really want to take this opportunity to thank each one of you, Dr. Shravan, Subramanyam, Mr. Anand, and Mr. Govind Rao for taking out time to speak with us. It has been a real pleasure to listen to your views and feedback on the budget. Thank you so much.